Hi, welcome to Compassionate Journeys, conversations about home care and hospice. This is Cindy Cantrell, and today I am joined by wound ostomy nurses Marian Barry-Ravigni of Hallmark VNA and Rachael Sacco of MelroseWakefield Hospital. And thank you both very much for joining us. And
thanks for having us.
So today we are going to talk about some very basic things, ileostomies and stomas and things that people might have vaguely been aware of and might not know exactly what they are, but everything is extremely important, and a diagnosis might come either for yourself or a friend or family member, and you might want to learn about it very quickly. And I feel like that's your entire job, where people might get something, a diagnosis or have a procedure, and they might be a little bit shell-shocked and need some help right away. I'd love to please, if you wouldn't mind starting off by just letting us know kind of what people need to know immediately from you and, what you tell them.
First, I'm Marian, and this is my coworker, Rachael, my partner in crime. I think the biggest thing is, what is an ostomy?
Yeah.
And an ostomy, it's an opening in the organ of the body where it protrudes usually from the abdomen. Why do people have ostomies? Cancer is a big one.
Yeah.
Diverticulitis, bowel blockage, birth defects. There are multiple reasons. There are ileostomies, there are colostomies, there are urostomies, and a urostomy comes from the bladder. Maybe someone had their bladder removed for bladder cancer. So there's a lot of different reasons why. So we just wanted to explain what it is and what happens. In a great case scenario, the patient would meet with the doctor, and the doctor would, tell them what was going on and then refer them to Rachael here at the hospital. And Rachael would do her tricks and mark the stoma, which is...
So, if someone comes in emergently so they come in with abdominal pain or they burn syndrome, they find that there's some sort of issue, they need to go to the operating room, and then they need an ostomy. They have to make sure that the ostomy is placed in the best possible location. But if someone's lying flat on the table in an emergency situation, that always can't be, appreciated. So when I see a patient beforehand, if it's, that's the best case scenario, I look at their abdomen, sitting, lying, standing. I kind of help the doctor position that where the patient will be able to see it, so they could actually take care of it better, have more success. And I think it's important for them to meet with me beforehand, so they have sometimes I can be a familiar face, right? They know me after surgery. It's very traumatic. Even when they know, and I always say, even when people know that this is kind of like last case scenario where they need this, they still never want it. So that's what I do. So I mark stomas. So then my job is, in an ideal situation, meeting with them beforehand, talking to them, and then when I see them post-operatively, it's the beginning education. I always say that, we're all different, right? And people sometimes have a hard time even looking at it and touching it, and take care of it is a big obstacle for them, even like emptying it or, all the things that are involved, and they get overwhelmed by that.
And I think, too, actually, the stoma itself, what is a stoma? It is a piece of your intestine. And I always try to say to the patient, I want to talk to you in layman's terms. I don't want to be disrespectful, so please take what I say carefully. And I say to someone that your plumbing has been rebooted.
Yeah.
The way that you used to go to the bathroom and get rid of your stool is different now. It's coming through your abdomen. So what we do, like Rachael said, she marks the patient exactly, or the best place for the patient to be able to take care of the stoma. So the piece of intestine is brought out through the abdomen, and it almost looks like a hose. And it is turned down like you would turn down a turtleneck sweater, and the skin is sewn into the abdomen, so it's nice and stationary. And it looks really like a strawberry. It looks like a red bud sticking out. And what they make an opening in that, which is called an os. and that's where the effluent comes from. So our job is really, usually right after surgery, this stoma, this red strawberry sticking out of your abdomen, is usually large and edematous. So what we want to do is make sure that the right size appliance is on that patient. And by that, it's usually a wafer. And we want it to stick. We want it to hold on firmly to the abdomen. We want it to be comfortable. We don't want it to choke the stoma.
Yeah.
It will shrink down in size. So Rachel and I teach the patient you have to measure it with a measuring guide. Another really important thing is that you want to make sure the skin around this stoma stays nice and clean, because like an infant, if an infant has a bowel movement in that diaper and that patient and the child stays in the diaper for a long period of time, there's going to be chafing, there's going to be skin breakdown, there's going to be irritation, there may be chance of an infection. So we want to make sure the right appliance is on that patient and that they know how to measure it. But Rachel has the great job of, okay, she's the first one they see, so she has to make sure at least they can empty it before they leave. So,
which is a challenge sometimes, because I always tell my patients, I understand that not only are you dealing with this new ostomy, you're also recovering from surgery, so you're uncomfortable, you're in pain, you're processing all of this information. So I try and see them every day, and if it's just like this is a social call, I just want to say hi, just so they know that I'm there if they need me. But yeah, my goal is to have them at least able to empty the pouch when they leave the hospital. And me and Marian are really good, because we'll collaborate and talk. I'll bring her in and say, hey, I have this patient, I'm going to send them to you, this is what I've done. So they know that when they leave the hospital, that they've already got someone that's on their side, that they can now we're kind of, I'd say, pass the baton to her. So it's worked out really well. It's been a good situation.
And when we talk about something fitting securely, this is the wafer and this is the stoma here that comes out. So we want to make sure that the stoma is fit snugly around this opening. And we just kind of give the patient the basic understanding. You can call this a pouch, you can call this a bag. It has to be empty. Everything has to stay clean. So it's really Rachel's job in the hospital to make sure that they can at least independently empty this appliance before they leave here.
Yeah.
In a perfect situation, to be able to change the whole appliance by removing it from the abdomen. And you also teach them how to wash it, clean it.
Yes. So I try not to overwhelm them. So there's a lot of there's these products that are kind of like the essentials, so to speak, that they have to have these. But there's a lot of accessory products that they might need or might not need. And usually early on, they don't need them. So I don't want to overwhelm them with all this information. So I try and keep it real simple, keep it very uniform, consistent. So we work on a task. I don't want to have throw all these two different tasks at them, so then they're overwhelmed. It's one task, let's work on this consistently. And I always say to these patients, utilize us. We're here 24/7 to help you. The more you can do for yourself while you're in the hospital, the better you're going to be long term. Whether or not they buy into that at this point, it's individual, it depends on the person.
And I think part of it too is some people may have difficulty with vision, so it's hard for them to work with the appliance. And it all depends too where the stoma is placed. I mean, some people are very large, some people have large abdomens, some people have sunken in abdomens. So not only are we working with their medical concerns, we're working with their social concerns, their psychological. Is someone going to smell me? Am I going to be able to change this by myself? Am I going to be able to go back out to dinner? Am I going to golf? Am I going to swim? A young person, I can't imagine a young man or a woman that's starting off in their maturity and in their life. They want to have, a sexual experience too with and I think that's really, really difficult. How do you accept that right there and then? So, and then there's too, like, cultural backgrounds. People from different cultures, I mean, like, this is dirty. This is not acceptable. Body image is really, really a big deal. And some people are fortunate enough that it's only going to be a temporary ostomy.
Yeah.
So, we know that, okay, there's a light at the end of the tunnel, but for some unfortunate people, you're going to live with this for the rest of your life. So, so our biggest thing is education, emotional support, getting them the products they need, teaching them how to order supplies. Rachel's great about sending a patient back to me with supplies to get them started. And then when I take the baton from her, that's when the stomy usually starts to change a little bit. So we may have to go to a smaller appliance. We may have to use something like a hernia belt, because sometimes what happens after surgery is the abdominal muscles get very, very weak and people start getting a hernia. That's it's an outpouching of the abdominal wall. That can also happen. So, okay, so what products do you need for that? How do I go about ordering my supplies if I am going to have this for a long period of time? So that's something else we take into consideration. Are they going to be able to do that by themselves? Who is involved? Who is willing and able to help you? Some people are just so offended by the whole thing that they won't even look at their stoma.
Oh.
Yeah, and I read this great quote, and I forget who it said, so it escapes me, but that participation in an activity is a sign of acceptance, and they kind of go hand in hand. And it's varied for people. I mean, it's totally like, it depends. But again, like, this could be the gamut. You have your patient that comes in with abdominal pain, they find out that they've got colon cancer. Mm-hmm. So now they're dealing with a cancer diagnosis. They're dealing with all that involves. Their life has been turned upside down. And then we have the patients that come in with the diverticulitis, which is an inflammation of those diverticulum in your bowel. Not as ominous as an issue. So then, so it depends. Like, but then you have those cancer patients who come in and they handle things graciously. And it's not to say that that's worse or better than anybody else. It's just by being human, we're different.
Yeah. And I think too, what goes along with it too, if someone has an ileostomy, their whole diet has to change.
Yeah.
So that's a lot of diet teaching that we have to do too, to make sure that they're not going to end up with a blockage. And people with a ileostomy, and that is where the bowel is cut. So it all depends, if it's the bowel is cut in one area, if it's an ileostomy, it's cut in another area if it's a colostomy. So we have to teach people with an ileostomy the importance of hydration, because they have a real fluid imbalance, which can be very scary, and they can end up in the hospital and need IV intervention. Yeah. Cindy, I think we lost you. There you are.
No, I'm just learning a lot, actually.
So I mean, diet, hydration, cleanliness.
Yeah. Would you mind talking a little bit more about maybe body image and maybe why it's so difficult for people to, I can see how it would be so overwhelming, all of that. But for the people who maybe have a hard time looking at it and feeling like, accepting it, or feeling like this is my reality now and moving on, maybe the strategies that you use to make them feel more comfortable, because you've both been doing this so long, you probably have great ways of doing it.
Well, I think that what I impress upon people is people want to feel normal.
Yeah.
And I think I impress upon them that, this is like any life-changing event. It becomes part of your everyday, then it becomes your normal. And it's about accepting that change on a daily basis and not looking too far ahead, because I think that when we look too far ahead, it can get us in not such a good place emotionally.
Yeah.
So I think that, yes, it's good to plan, it's good to prepare, it's good to have all that information that you need, but also we need to just scale it back and say, let's just tone it down and take it down and learn these little things, And
I think part of my is, this is a grieving process.
Yes.
Yeah.
This is a loss.
Yeah.
It may be a loss of your independence. It's a loss of your body image, so grieve it. As with any loss, you have to grieve this. You can be mad, you can be angry, you can be upset, and you can have your moments, and you can have maybe a day, but you cannot live like this.
Yeah.
Because you don't have a choice here. It's either, do you want to learn to live your life again, or do you want to just lay down and die and let life go on without you? And sometimes, and I do try to put myself in that situation. I had a brother and a sister, both had ostomies. And my sister's issue really was more, she had an ileostomy, so it was more with leakage. And it's like, being able to go out. We do teach them about, different kinds of clothes that they can wear that may shape it different. There is special underwear out there now that helps people, hide it, both for men and for women.
Okay.
There are ostomy covers that people make that we introduce that to. We give them the information about this underwear. Or like I had a gentleman who is in a band, and I got him the information he needed to support that ostomy appliance. And he's out playing in the band again.
Yeah.
So everybody is different, every situation, how they handle it, but grieve it.
Yeah.
Accept it and try to move on with it. And sometimes it's going to be easier than others, and we just try to give them the information that they need to foster independence, to live their life as best as they can. And I think for the most part, from the people that we've shared, they have done okay with it.
They have.
We introduce them to support groups.
Yep.
We talk to other patients and say, gee, I have somebody. Do you think that would be possible? Would you call them? Would they call you? And, because like going to Weight Watchers or Alcoholics Anonymous, you don't know what it's like until it happens to you. So sharing that experience with someone else that's in the same boat makes a big difference.
Can you talk about maybe some of the topics that are raised in the support groups? Maybe some of the, we've touched on a few of them certainly, because I think you're right. It is important to give people permission to grieve and to validate that, but then also to give them hope. But I'm sure that there are going to be questions and concerns for as long as they have it. Maybe things that come up that they're not even expecting, or, oh, can I do this? Or can I do that? Or even friends and family. Can I invite them to do this or that? Or would this make them uncomfortable?
Well, I think a lot of people now want to experiment with different products.
Okay.
So that,
yeah.
They experiment with different products, especially now with YouTube.
Yeah.
And there's so much out there on the internet. But when I first started going to the ostomy support groups, the biggest thing was if they had an accident. So what we do is say, okay, we're going to give you a little going away bag. And in that going away bag, you are going to carry this, and you're going to carry everything that you need to get yourself into a restroom, to get yourself cleaned up and ready to go.
Yeah.
So we make sure that they have a little going away bag. And of course, for traveling, we always tell them, you keep your ostomy appliance with you when you carry on.
Yeah.
It doesn't get shipped anywhere. But in the support groups that I went to was more about diet. What do I do about leakage? Can I go swimming? And can I play golf? Those were kind of the big things that I heard about. But now moving on, I hear a lot of people saying, oh, I saw this advertised. Do you think it's okay if I try this? And our thing is, you want to try it? We give you the number, call these different companies, and they're great. The companies that we use are awesome because they'll send out a couple of supplies to try this, because there's pouches that are opaque and they're transparent, and we have one piece and we have two piece and we have Velcro closures. I mean, we go the whole gamut here. We like accessorize it.
Is that new, or has that been for a long time, or is there just more product awareness and more availability now?
I think both. I think that things are definitely multiplying, as far as availability. And I think our mode of obtaining these products has definitely multiplied too. So I think it's just a huge awareness of like different things, like, so I think both.
Yes, it's not like way back when I went in to see this older gentleman and he had the bottom, here's the pouch, the bottom of the pouch all tied up in an elastic.
Oh gosh, yeah.
So but I think younger people are more aware and they are more in tune with their disease and how they want to dress and how they want to look.
Yeah.
So they're always investigating new things.
Yeah.
So however we can get that information to them, and if we don't have it, I call Rachel. Rachel calls me. We call a company. We make it work.
Yeah. It seems like you do have a great collaboration and a great relationship with each other and a great positivity, which I think is the key, especially if somebody, like you said, has just had a terrible diagnosis or an outcome that they weren't expecting or don't want and are having a hard time accepting. I think that positivity is key. And so I hear that from both of you, which I think is so great. And I bet that is transferred to the patient.
Cindy, what's funny is Rachel will call me and say, Marian, I have so-and-so. Oh, I just love this patient. And I say,
Aww.
Rachel, is there any patient you don't love? Is there any patient you don't love? Oh, you're going to love them. She says, you're just going to love them. And after it's like, and then I might be at the patient's home and I'll call Rachel and I'll say, hey, I have Rachel on the phone. Oh, hi, Rachel.
So like, here's the thing, right? They need you at a time in their life when they're most vulnerable and they need that positivity.
Yeah.
And I try to, and Marian, like, like we try to, and like, what's the word? Like, like just emote that or whatever the word, like to try and just be like, you're going to be okay.
Yeah.
You're gonna get this. Like, it may not be like tomorrow. And I think the key thing, and that's why these podcasts are so important, because this isn't just about the patients. We need the positivity to come from their friends and family, that they're not afraid about it, that they can have people that aren't like looking at them like there's something wrong with them, that they understand that there's nothing wrong with this.
Yeah.
Right? And they accept it too, because that's important for the person,
especially a partner, husband or wife or roommate. I mean, because we're going to have accidents, we're going to have a messy bathroom periodically.
Sure.
But I mean, what's great, I really find, is Rachel introduces the patient to me before I meet the patient.
Yeah.
The patient trusts her already because of the care that she has given them. Sends them home with what they need, and I go in and go, oh yeah, Rachel sent me. Oh, Rachel. So it just makes it. They felt so highly of Rachel, and I do. If I have, God forbid, I need an ostomy or I need a nurse, this is the girl. Same with me. She's an outstanding nurse, and she's a real caring person, and I feel blessed to be able to work with her.
Yeah.
Beautiful. Yeah, me and her have been nurses a long time.
Yeah.
And
it's an honor to take care of these people.
And I feel blessed to have found something in nursing that I absolutely love. Like that, I feel like
we have passion for it.
Yeah, I can see that.
These people, to live their life as independently as possible.
Yeah.
To move on to the best of their ability. And okay, you're gonna be okay. And let's see, just put one foot in front of the other and do the best you can. You're gonna be okay.
And I say to them too, it's like, throw something at me, throw me a scenario. What's on your mind? What's on your mind?
Oh,
Tell
that's
me.
so important.
Through
yeah. Yeah, because I bet they share things with you that they're afraid to even say out loud, that they probably would never.
Silly.
Like, let me have it. Talk to me. Tell me. You're afraid. And one of my mantras is, what happened in the bathroom before happens in there again. So you keep stuff in there. So they want, again, to go back to normalcy.
Yeah.
They want to feel normal.
Yeah.
Life is throwing them a curveball, and they want to get back to who they were.
Yeah.
The new
normal.
Yeah.
Yep. But there is life after an ostomy. There's life. And I think that is what we have to say. There is life. We will help you get through it. We will help you.
And it is just doing things a different way.
Exactly. Like if someone became a diabetic, they
Yeah.
have to learn to like monitor the blood sugars, eat certain things. If if there's a host of things that like life throws at us,
Amputation.
an amputation, like what anything, like like the unfortunately the possibilities are limitless. And we try and be like, what, this is as life altering as this is to you, it's not going to always feel like this. It's not going to always have the intensity of emotion. It's going to let that vice is going to let go and let go and let go.
It's funny when you first go in, it's one thing, and then a couple of weeks down the line, it's like, I can't believe I'm doing this.
Right.
You were right. You were actually. It's like, yeah, I know. I'm always right. I tell my husband I'm always right. It's like, I know I'm right. But it's like they feel so like, oh my God, they just conquered Mount Everest,
And they have.
To them, they have.
And they have. Yeah, their own personal Mount Everest. They definitely have. It's a interesting role to be in because you're performing a task, but you're also, I think, equally as important as dealing with what's going on upstairs in the mind.
Absolutely. Yeah.
And I think the medical system in our current system is just so overwhelmed and overburdened for obvious reasons I won't even mention, that it's just, I think people get lost in the shuffle, and we want them to know that, like, if
there's someone out there that really cares about you and is going to help you.
Yeah. It sounds like, I mean, with so much of nursing, but it sounds like such a privilege to care for these patients because they, like you said, they're so vulnerable, and they need you, and you have very specific information that they can't get anywhere else, and you instantly improve their quality of lives. It must be incredibly rewarding.
I mean, like I had a patient last week, and I said, listen, I go, you got to work with me here. You're leaving soon. I said, you got to like start emptying this. I go, what are you going to do when you get home?
Yeah.
She said, I'm going to pay somebody. I said, they're not with you 24/7. I go, what about when you go out to dinner? She looks at me and she goes, you are funny out to dinner. I go, yes, go out to dinner.
Yeah.
You're going to live a normal life. You're going to be, out to dinner. She thought I was funny because I said that,
that raises a good question, actually. So what happens if somebody goes home and feels like, oh, I'm emptying my bag, in front of Rachel, I'm doing okay. And then they get home and feel like, oh, I just forgot everything that I just learned, and what's happening?
Usually it does happen because your hospital stay isn't too long.
Yeah.
And the thing is, like we talked about the emotional and the physical and all that. You're tired, you're overwhelmed, you're disgusted, you're depressed.
Sure. All of that, yeah.
So
and
Rachel
in pain.
Does all of that, and then they get home and go, I don't know. I don't know. I don't remember. So it's like, all right, first things first.
Yep.
So this is what we do. And we're fortunate enough. I work with another fellow who is a wound ostomy nurse. And, usually it's he or I, Tim or myself, that see these ostomy patients when they go home. And he's a gentle soul. And he, teaches patients the same way that we do. So we're kind of all on the same page. But we do let the patient know there's a nurse on call 24 hours a day. And the most important thing is even when you're covered with poop here, try not to panic. I mean, there's someone that can walk you through this, and like Tim or myself would be out there. The office would call, or the on-call nurse would send a message to the office and try to get one of us out there first thing in the morning. We try. But yes, accidents are going to happen, and in the beginning, they're going to be more frequent than not.
Yeah.
And we do try to get a family member involved, even like, okay, you might be leaking, but is there some sort of like a special tape that we might have that can you put this on just to get through the morning?
Yeah.
Something in the case like that.
Yeah.
We try to have some backup plan.
Yep.
Sometimes the backup plan needs a backup plan. That's what happens.
Oh, yeah.
That's a good metaphor for all of life.
What do they say, Cindy? Poop happened, And it does. Trust me, it's happened on my sneakers. It's happened on my sneakers. It's like, okay, it's all right. No problem.
Yep. Well, that is a good metaphor, I think, for all of life, even for people who don't have that. Yeah.
True.
No, thank you. This has been so informative. I've really learned a lot, and I think that anybody listening to this, I think, will, and also just be more empathetic and hopefully more positive as well. And thank you both for all of your time and for the work that you're doing to help patients and the entire community.
No, it's our pleasure. Thank you so much for taking the time and the interest, because ostomies are a fact of life.
Absolutely.
And, that we get the word out there to try to help people in any way, shape, or form that we can, that's great.
Yeah. Well, thank you both. I appreciate your time.
Thank you so much.
Our pleasure.
Take care, Cindy.
Thank you.